Hello, everybody. Welcome back. This is Adam Rosen, and thanks for tuning in. In today's episode, I just wanted to talk to you a little bit about backs and knees and how they're similar and how they're different. Like a lot of you have probably experienced, I was dealing with a lot of back pain. Obviously, our job is pretty physical, and a lot of orthopedic surgeons, after a number of years, have shoulder issues and hand issues and back issues. So my back's been bugging me for a while, and for about 4 6 weeks, I had horrible radicular pain and numbness. So it had me thinking a lot about my back. And I came up with a few other analogies that I've been using with my patients, and I think it may make a lot of sense to you. So when patients come to see us, I have a lot of patients that walk in the door and say, I have knee pain, I want a knee replacement. My friend had a knee replacement, and they love it. They wish they did it sooner. But not everybody starts at the same place. And if you think about it, I ask people, how many times do you know somebody with back pain that shows up wanting back surgery? And people think, yeah, not normally. You don't rush to have back surgery. But a lot of people have back pain. So what do? They might see a doctor, and then if you have back pain, what do? Well, you usually start with medications. And then most commonly, people go to physical therapy. Why? You want to strengthen the muscles that support your back. So we talk about core exercises, strengthening your stomach and strengthening your back muscles. And for a lot of people, that makes their back pain better. So the same thing in the knee, that if you have knee pain, you want to strengthen your knee core muscles. So those would be the muscles in front and behind your leg, your hamstrings and your quad. And a lot of people find that by strengthening those core knee muscles, that their knee pain diminishes or subsides. So it's always a good first line treatment. And then you may even have people that say, well, I did my medications and I strengthened my core, but I still had back pain. I got some epidural steroid injections. And the same thing in the knee. We might do some cortisone injections to reduce the pain and the inflammation. And then if all of that fails, those people then have back surgery. So in the same sense that if you have knee pain, don't rush to knee replacement. Still strengthen your muscles, try some medications, and then if that doesn't help, knee replacement may be the next step. Now, that's the similarity of knees and backs. How is it different? This is the other issue that I ran up with patients recently. A few patients had back surgery, and they had fusions. So they were very surprised when I explained the whole process of rehabilitation and physical therapy and being up and moving right away, and how that was so different from their back surgery rehabilitation, or their back surgery, not really rehab, but recovery. Because they said, I had back surgery and I just had to go home and rest. And I was out of work for 3 weeks and just basically laid around for 6 or 8 weeks while my back fused. So if you have back surgery and they're doing a fusion, the goal of that surgery is to make your back stiff. We don't want it to move. That was the goal of that particular surgery. If you have knee replacement surgery and you go home and you do a back recovery for your knee surgery, your knee will be stiff. Your knee will fuse. So we need to get your knee moving. We have to get range of motion. So it was just something that I was trying to reiterate to a couple of these patients, and I just found it sort of surprising that they had the mentality that I'm going to go home and lay on the sofa like I did after my back operation and my knee will just be fine. But the recovery is totally different because we're talking about rehabilitation. We're putting in a joint which needs to bend and move. So the rehab is going to be very different from your back surgery where they put in plates and rods and screws and cages to get that area to fuse. So just a short little video today, but I thought you might find those little analogies interesting, that if you have knee pain, you may not rush to knee replacement, and like your back, you want to strengthen the muscles that surround those structures, try medications, and then if that fails, consider surgery. And then if you have knee replacement surgery, your recovery and rehabilitation is going to be extremely different from a procedure like a back fusion, where the goal is to get that back to fuse. We do not want your knee to fuse. We want you to have good range of motion. So until next time, stay safe. Thanks for watching. If you haven't already subscribed, please subscribe. If you like this video and other videos, give a thumbs up. It helps people like you find these videos on YouTube. Until next time, I'm Adam Rosen. Take care.